Welcome to this live lesson on coding as a profession by Medical Coding by Jen. Today we will explore what it means to be a medical coder, the different types of coding specialties, and the various aspects of healthcare coding that you need to understand. Whether you're considering a career in coding or just want to learn more about it, this lesson will give you a solid foundation. Let's get started. The role of coding in healthcare. Every time someone receives healthcare, a detailed record is kept of everything that happened, observations, medical or surgical procedures, diagnostic tests, and treatment outcomes. Coding is the process of translating this written or dictated medical record into a series of numeric and alphanumeric codes. These codes cover diagnoses, medical and surgical services or procedures, and supplies. Why is this important? These code sets serve as a common language, making it easier to collect data, track diseases, evaluate the quality of care, and determine costs and reimbursements. In other words, coding is crucial for both healthcare management and financial processes. The process of coding. Proper code assignment depends on two key factors: the content documented in the medical record and the specific rules that govern each code set. These rules can vary depending on who pays for the patient care, such as self-pay patients or those with health insurance. Typically, coding is performed either by the physician or by a dedicated coder. If the physician does the coding, the coder may act as an auditor, ensuring that the codes chosen by the physician match the documentation in the record. In other cases, coders receive the medical record and assign codes based on what is documented. Accuracy in the medical record is critical. If the record is inaccurate or incomplete, it won't translate correctly into codes, which can lead to errors in billing or patient care. Coders must evaluate medical records for completeness and accuracy, and they often need to communicate with physicians and other healthcare professionals to clarify diagnoses or get additional patient information. Now, if this information is helpful, please comment, share, and like this video. Your participation helps others find this content. Types of coding specialties. There are different types of coding, each focusing on specific aspects of healthcare. Outpatient coding, this focuses on physician professional services and coding for outpatient facilities. Outpatient coders work primarily with CPT, HCPC's Level 2, and ICD-10-CM codes. They often work in physician offices, outpatient clinics, and outpatient departments of hospitals. Outpatient facility coders also work with ambulatory payment classifications. Inpatient coding, this is more specialized and focuses on coding for hospital inpatient services. Inpatient coders use ICD-10-CM and ICD-10-PCS codes and are responsible for assigning medical severity diagnosis-related groups. Risk adjustment coding. This type of coding focuses exclusively on diagnosis coding using the ICD-10-CM code set. Risk adjustment diagnoses are pulled from claims data and medical record documentation across all settings. Risk adjustment coders often work for health plans, providers, or other healthcare entities. Regardless of the coding specialty, it's important to note that code updates and insurance payment policies can change as frequently as every quarter. This means that ongoing education is essential for coders to stay current with the latest changes. Understanding the healthcare hierarchy. This is where you can take notes. Start by adding abbreviated versions of this information into a notebook. Later, we will move this information to exam manuals like the CPT, HCPCs, and ICD books. In healthcare, various providers work together to deliver patient care. These include physicians and non-physician providers, NPPS, also known as mid-level providers or physician extenders, such as physician assistants, PAs, and nurse practitioners, NPS. NPPs often have different reimbursement rates than physicians and require physician oversight. Each state has specific guidelines for the scope of practice for these different provider levels. So it's important to check with your state health board for the most accurate information. Types of payers in healthcare. Again, this is a place to take notes on. While some patients may pay for their own medical expenses, most will have some type of insurance coverage. There are two primary types of insurers. Commercial carriers, these are private payers that offer both group and individual plans. They may cover a range of services from hospitalization to basic and major medical coverage. Companies like Blue Cross Blue Shield are examples of commercial carriers. Government insurers, the most significant government insurer is Medicare, a federal health insurance program administered by the Centers for Medicare and Medicaid Services, CMS. Medicare provides coverage for people over 65, as well as for those who are blind, disabled, or have end-stage renal disease, ESRD. Medicare is divided into several parts. Medicare Part A covers inpatient hospital care, skilled nursing facilities, hospice care, and home health care. Medicare Part B covers medically necessary physician services, outpatient care, and other medical services not covered by Part A. It's optional and requires a premium. Medicare Part C, or Medicare Advantage, combines the benefits of Parts A and B, and sometimes Part D. These plans are managed by private insurers approved by Medicare. Medicare Part D is a prescription drug program available to all Medicare beneficiaries, provided by private companies approved by Medicare. Medicaid is a joint federal and state program that helps with medical costs for low-income individuals, including children and pregnant women. Each state administers its own Medicaid program, but they must follow federal guidelines. There are also state-funded insurance programs that provide coverage for children up to 21 years of age. I hope you made lots of notes on the parts of Medicare. Conclusion. In conclusion, coding is an integral part of the healthcare system. It ensures that healthcare providers are accurately documenting patient care, which is essential for both clinical management and financial reimbursement. Whether you're coding for outpatient services, inpatient care, or risk adjustment, staying informed about the latest updates and guidelines is crucial. I hope this lesson has provided a clear overview of coding as a profession. Remember, coding is not just about entering numbers. It's about understanding the patient's story and making sure it's accurately reflected in the healthcare system. Thank you for joining this live lesson. I hope you found this episode helpful. If you did, please like, comment, and share this podcast with your fellow coders. Don't forget to subscribe so you never miss out on more tips and insights. Thanks for tuning in to Medical Coding by Jen, and happy coding!